This is Checkup with Dr. Bastian, where we talk about health-related issues and get great medical advice from orthopedic surgeon based in Glendale, Dr. Sevag Bastian. How are you?
I'm great, Maria. How are you?
I'm great. So let's get to it. The topic today is preventive health. Why is preventive health so important in today's medicine?
It's key, Maria. It's very important. It's always best to get ahead of things with respect to an injury or some sort of disease. You want to be on top of it before you have to start taking medications for it.
Yeah.
The big ones are diabetes and blood pressure. A lot of people have this, and they don't take their medications sometimes because they feel like they don't feel it day to day, so they get behind, and then all of a sudden it's too late. So it's always good to stay on top of these things, stay ahead, and hopefully prevent it. I mean, diet, exercise, good life habits, no smoking, simple things. These are all going to be key to give you longevity in your life and also good health. Not just long life, but good life.
Absolutely. And so, which brings me to my next question. Are there any annual screenings you suggest for both men and women?
Yeah, there's a few that are recommended, there's a few that are optional, and there's a few that are different based on your family history.
Right.
So obviously a risk factor of developing anything medical is if you've had it before or someone in your family's had it before.
Correct.
So that always changes the screening process. I highly recommend doing at least once a year physicals. If you're diabetic, more often, like every 6 months, get your hemoglobin A1C checked. That's a key blood marker that it would be ideal to keep a track of.
Right.
Specific screenings, 50 and up, men and women need colon cancer screening. Unfortunately, that's a colonoscopy, but we all gotta do it. And it's every 5 to 10 years after that based on any risk factors such as family history or your own personal history.
Right.
A big one that I like to always stress about as an orthopedic surgeon is good bone health and looking for osteoporosis.
Yes.
It affects women more than men, and we recommend what's called a DEXA scan. It's a bone density scan on everybody. It's always good to have good bone health, take your vitamins.
And that's like a 10-minute scan, the DEXA scan?
Yeah, it's
super quick.
It's very quick.
Yeah.
It gives us great data. We can start you on another medication or hormonal therapy to increase your bone density, so that we can prevent a broken bone after like a fall, which is a tough problem to have. So why not know about it beforehand?
Absolutely.
So women over 40, it's recommended to start checking for breast cancer, and that could be with a physical exam or a mammogram or an ultrasound. Other routine screening that we could consider are just your things that'll be caught up kind of on a physical exam on your annual physical, such as checking your heart and lungs. Key, it's always good to get ahead of a murmur. If you pick it up, I actually have a family member who just got that picked up, and we're glad that we picked it up early because now we're working it up, and it's good to know this thing earlier rather than later.
So now it's time to debunk the myth. So every segment we're going to debunk a popular myth. So today's myth is drinking 8 glasses of water a day. Is that myth or truth, Dr. Bastian?
So drinking water is always great. There's no objective specific number of this is the number of ounces you're supposed to drink. It's always different based on man or woman and your weight. A good way to judge it is really the color of your urine. That's kind of a good way to know if you're hydrated or not. If it's clear, that means you're pretty well hydrated. Hydration is key. It's like flushing out your system. The solution to pollution is dilution. And that works not just with water in the body, but it works with infections. It's what we do surgically to clear infections. We open it up, decompress it, and then wash it. Solution to pollution is dilution.
Perfect. Well, thank you so much for checking in, Dr. Bastian.
Until next time.
Stay tuned for more of the Maria Cozette Show.